You know how it is when you're watching TV and a commercial for some new drug comes on? They spend like 10 seconds telling you how it'll change your life, and then a super fast voice rattles off this huge list of all the terrible things that might happen. It's kind of weird, right? But it gets to this massive question in medicine. What happens when the thing that's supposed to heal you actually hurts you? Let's dive in.
Yeah, that long list, it's not just there for the lawyers. It's actually a window into something really critical for patient safety. We throw around the term side effect all the time, but in the medical world, there's a more specific term we need to know. And understanding that is step one.
And here it is, the key definition, an adverse effect. The crucial word here is harmful. It's any undesired effect that causes harm. And notice how broad that is. It's not just about pills. It could be from any medical intervention, even something like surgery. Okay, let's break this down because this is super important and people mix these up constantly. A side effect is often predictable, maybe even expected. Think about an antihistamine making you drowsy. Annoying? Yes. Harmful? Not usually. But an adverse effect is specifically harmful. And neither of those is a medical error, which is totally different. That's when harm comes from a straight-up mistake, like getting the wrong dose. Knowing these differences is absolutely key.
So, knowing the lingo is one thing, but really getting a grip on the real-world impact, that's something else entirely. And let me tell you, the stakes could not be higher.
Just look at that number for a second. In one single year, 142,000 people died globally from the adverse effects of medical treatment. And it's so important to understand this isn't about doctors making mistakes. This is about the inherent risks that can come with treatments that are designed to save us. It's a sobering number, and it shows you exactly why this is taken so seriously.
And this quote right here, it perfectly explains what takes an adverse effect and kicks it up a notch to serious. We're not talking about a little nausea or a mild rash. When researchers in clinical trials are tracking serious adverse events, this is what they mean. We're talking about life-changing, permanent, or even fatal outcomes. Okay, so if the stakes are that high, how in the world do we keep track of it all? I mean, how does a doctor in Spain learn from something that happened to a patient in Japan? The answer is pretty amazing, actually. It's this huge, interconnected system. We've essentially built a global safety net. But this thing wasn't just created out of thin air. It was really forged in the fire of tragedy, most famously the thalidomide disaster in the 1960s. That crisis showed the whole world the devastating price of not having a system to spot and report these effects quickly. That tragedy led directly to systems like the UK's Yellow Card scheme. It's a direct line for doctors and patients, too, to report problems. And what's really cool is how wide its net is. It's not just for prescription drugs. It covers everything from herbal supplements to, get this, even cosmetic treatments. And this response was happening all over. Over in the US, the system's a little more broken up. You've got MedWatch as the main reporting hub, but then there are these specialized systems like VAERS just for vaccines or MAUDE for medical devices. This lets them get really focused on collecting specific kinds of data to keep people safe. And it really is a worldwide thing. From Australia to New Zealand to Canada, you see this pattern everywhere. Each country's system acts like a piece of a giant global puzzle, all working together to help us understand treatment safety and make sure the tragedies of the past don't happen again. It's an impressive network, no doubt, but it definitely begs the question, with all this in place, are these systems foolproof? Well, the short answer is no, not even close. The truth is, reporting this stuff is incredibly complex. I mean, just think about it. If you have the flu and you get a headache, is it from the virus or is it from the flu medicine you took? The doctor has to make a judgment call. And what about subtle effects that show up years later? Those are so hard to link back. It all means that, without a doubt, adverse effects are being underreported. So far, we've been talking a lot about medications, and it's easy to fall into that trap. But it's a huge misconception that adverse effects are just about pills. Harm can come from a whole range of medical interventions. This slide really puts it all into perspective, right? We focus on drugs, but surgery has its own risks, like infection or scarring. Radiation can cause skin burns. Heck, even a diagnostic test isn't risk-free. A person can have a massive allergic reaction to the dye used in a CT scan, or a routine colonoscopy could, in rare cases, cause a tear. It's a powerful reminder that every single intervention requires that careful dance of weighing the benefit against the risk. And speaking of a broader perspective, let's just circle back to drugs for one more second, because we have to talk about a huge, often preventable problem:
drug interactions. This isn't about one single drug causing a problem. This is about how different substances can mix together in your body and cause absolute chaos.
And this quote, this gets to the absolute heart of the matter. Your doctor might prescribe something that's perfectly safe on its own, but what if you're also taking an over-the-counter painkiller, or even a herbal supplement like St. John's wort, which is famous for messing with all sorts of medications? If your doctor doesn't know, they can't protect you. Communication is literally everything.
So this brings us to the final and honestly the most important part of this whole discussion. It's all a delicate balancing act, and you, the patient, you play a huge role in tipping those scales towards safety. The big takeaway here is that you are not just a passenger in your own healthcare. You're an active participant. This slide is basically your playbook. Tell your doctor and pharmacist everything you take. Prescriptions, over-the-counter stuff, vitamins, that herbal tea you drink every night, everything. And if you start a new treatment and something feels weird, speak up. Your voice is one of the most powerful safety tools we have.
And so, we're left with a fundamental question that every single doctor, patient, and regulator has to wrestle with every day. We turn to medicine to help us and to heal us, but everything carries some kind of risk. A perfect balance might be impossible, but striving for it, through knowledge, through open communication, and through paying attention, well, that's what modern medicine is all about.